And the third treatment that I'm demonstrating tonight is a combination treatment, what I call bespoke neuromodulation, which means that I implement the power of the different neurotoxins that are currently on the market by tailoring them to different parts of the face and allowing each patient to have a completely tailored, individualized treatment that really utilizes the strengths and characteristics of the individual neurotoxins in different places. Our patient here has typical signs of dynamic animation rhytids. Frown for us. Here and here. Lift up your brows. Good. She's starting to get these areas as well. Give us a smile. And starting to get the crow's feet. Crinkle your nose. The bunny lines as shown here, these are typical signs of expressions that can become exacerbated after chronic treatment of the upper part of the face with neurotoxin, as this part of the face is no longer able to furrow. The recruitment of these muscles helps to reconstitute that kind of grimace that was the goal of that animation. Purse your lips for us. She doesn't have any rhytids around this area of the mouth, so she doesn't require any neuromodulation here. However, when she places her bottom lip over the top lip, there you go, she has this very characteristic pebbling appearance, which is significant for mentalis strain, where the strain of this muscle, the mentalis muscle of the chin, helps to diminish the subcutaneous fat pad that lives between the dermis, or the deep part of the skin, and the underlying muscle. When that fat pad is diminished or atrophied, this pebbling appearance becomes apparent. The other components we're going to demonstrate are the treatment of the masseter muscles. Clench down for us. This is the masseter muscle here that's palpable as well as visible. Our patient has a tendency to grind and to clench down at night, which gives her headaches as well as pain in the jawline and TMJ region. So for her, I will be using a product called Jeuveau, which is one of the neurotoxins that's most recently approved for the treatment of the glabellar lines. It's a very precise product that does take effect quite quickly. The next product I will be using is called Dysport. This is yet another neurotoxin that I like to use for the forehead as well as the crow's feet, as the result is very, very natural yet very effective. And finally, for areas such as the bunny lines, the mentalis, and the masseter, I will be using Botox, which is the initial neurotoxin that was approved in this country, which has a very predictable gold standard effect for those regions. So we will be starting with the glabella. This is a complex that's comprised of two muscles, largely the corrugators, which are in this orientation, that are responsible for the 11 lines, as well as the procerus muscle, which is in this orientation and is responsible for the transverse lines. We're going to be treating one half of her face, and I will be focusing on her left side. Frown for us. Little injection into the muscle belly, as well as laterally. And this is the corrugator, and centrally the procerus. And for this region, because of the precision as well as the onset that is anecdotally described with Jeuveau, I use Jeuveau in this region. Now I will be switching to Dysport, which has a slightly different characteristic profile. And for that product, I like to use it in the forehead to treat in a more diffuse fashion. Lift up your brows for us. In this region, you'd like to inject just above the brow in an orientation that allows, in my opinion, the targeting of the superficial aspect of the frontalis muscle, which is the muscle responsible for lifting the brows, but not getting too close in a patient such as this because you don't want to drop the brows. Lift up your brows one more time. And I'm going not in a parallel orientation, nor in a perpendicular orientation, but rather at an angle to be able to diffuse the product very naturally. This will allow a natural diminution of the muscle activity, resulting in a diminution of the wrinkles. Now I'm going to have her smile. Perfect. This area is also treated as she forms natural crow's feet or these transverse lines from the activation of the orbicularis oculi muscle. And that is the muscle that's targeted in this treatment, again with Dysport. Now that we've treated the upper part of the face, we're going to treat the lower part. And in particular, we're going to treat the masseter muscle as well as the mentalis. And we're going to have our patient bite down for us. And we're going to feel the base of the masseter. And I typically bite down again, inject in a 3-point system that allows this muscle to soften so that she can no longer clench in a strong fashion and cause herself pain. Now we will do the mentalis. Go ahead and pull that up and we'll hit these two areas. With care to avoid targeting any of the muscles that affect the position of the lip. The masseter as well as the mentalis muscle or the chin muscle were treated with Botox neurotoxin. That is the first FDA approved neurotoxin in this country, and that which is considered by most practitioners to remain as the gold standard. So now that the treatment is complete on this side of the face, I'm going to have our patient ice. The recommendation for icing is really to decrease the amount of pain and the possibility of bruising. I don't recommend that my patients massage the regions at all because I want the product to be maintained in the position of where I injected it precisely. And unless there's a reason to do a massage, I have them avoid it. I ask them not to sleep on their face for the first couple of nights, and I ask them to avoid exercise for the first 24 hours. And that is true of any of the injections that I performed. So this is Jeuveau, the newest of our toxins, and the more precise by indication. So I'm going to have you furrow, and this is treatment of the corrugator muscle, which is responsible for those 11 lines. And the procerus muscle, which is responsible for those transverse lines. And you want to know not only the location and the strength of the muscle, but also the depth, because if you inject too deeply, you might hit a vital structure or another muscle that you don't want, and vice versa. You may undertreat if you are not in the correct plane. Okay. Now we're going to switch to Dysport to treat the crow's feet, which are the lines here, as well as the right side of the forehead, as the other sides have been done. Give me a smile, and you can see the crinkling of this area. Most of her crow's feet are isolated to the upper half, which is one presentation. A lot of times patients have crow's feet all the way across. And lift up your brows. Good. So we're treating her frontalis muscle. I'm staying high because I don't want to drop her brows. She's got a very nice brow position. She doesn't have a lot of rhytids here, and so we can allow her to elevate her brows. In somebody who had those lines that are very aggressively formed in that region, I would have targeted much more strongly and much closer to the brow line. Now we're going to move on to the other muscles, and now I'm switching to Botox, and we're going to treat the bunny lines. Crinkle your nose for us, and I already treated the other side. And you want to stay high there. If you go too low, you will hit the muscles that elevate the upper lip, and that will cause an abnormally looking smile. Now we're going to do the chin like we did the other side. And you want to stay away from the muscles that control the lower lip movement. Finally, we're going to target the masseter muscle. And I will have you clench down, bite down one more time, and you can feel the muscle right here and trading up. So I'm hitting it as I can feel it contract in a triangular fashion. There are multiple ways of doing it. It really depends on the anatomy of the muscle, how wide it is, how thick it is, how strong it is. So now we've completed our treatment. What I tell my patients is that they can ice for pain control and any swelling or bruising. I don't want them to sleep on their face. No exercise for 24 hours. Other than that, I don't want them to massage any of the sites. I want the product to stay exactly where I injected it. And that's slightly different from Sculptra, which should be massaged. Any questions? Oh, very good. Any questions? Okay, well, thank you.